COVID-19, from mandatory to optional. Why we stopped masking.
When silence fell over the streets. It's hard to forget those early days. The world muffled behind masks. Supermarkets lined with masked faces, eyes darting nervously above blue fabric. The soft hiss of breath through filters, the fogged glasses, the sense that the air itself was dangerous. In New Zealand, masking became a symbol of solidarity. Our team of 5 million, protecting each other. But now? The same streets are full of bare faces. The masks are gone. The fear feels distant. So what happened? Did the virus change? Or did we? The symbol and the shield. At first, masks weren't just tools. They were symbols. They told others, I care, I'm cautious, I'm doing my part. But they were also controversial. Early in the pandemic, even experts disagreed. Some agencies said masks weren't needed. Others insisted they were essential. Eventually, the evidence grew clear. Masks reduced transmission, especially indoors. And in New Zealand, where elimination was the goal, every barrier mattered. The mask became part of our national identity. Tidy, disciplined, united. But symbols fade faster than habits form. The turning point. We didn't notice. The shift didn't happen overnight. Around mid-2022, Omicron swept through, highly contagious, yet milder for most. For the first time, infection didn't feel like a death sentence. Vaccines, boosters, prior infections. Together, they changed the landscape. Suddenly, the risk equation looked different. People started asking, if we can't eliminate COVID anymore, what's the point of masking? Mandates lifted. Mask fatigue set in. The masks slipped below noses, then into pockets, then disappeared. Society quietly declared, the emergency is over. Risk fatigue. The psychology of letting go. Humans aren't built for endless vigilance. You can only stay on high alert for so long before exhaustion takes over. Psychologists call it risk habituation. The more we live with danger, the less dangerous it feels. Like living near a railway. After a while, the noise fades. COVID became background noise, so even though masks still worked, the emotional reward disappeared. For most, wearing one now feels outdated, a leftover from a crisis they'd rather forget. Science versus sentiment. By late 2023, data kept confirming what many suspected. Vaccines prevented severe illness better than masks prevented infection. The virus evolved, but humans adapted faster, not biologically, but behaviorally. Once governments stopped requiring masks, social pressure flipped. Now mask wearers stood out, not the unmasked. Science said one thing, any barrier helps, but sentiment said another. We're done with this. And in the battle between logic and emotion usually wins. The Kiwi context. In New Zealand, the story was unique. Our early success against COVID created a paradox. We were one of the last countries to drop mandates because they'd worked so well. But when Omicron hit, the strategy of elimination collapsed under sheer transmissibility. The government pivoted to mitigation, learning to live with the virus. And masks, once a national badge of unity, became a personal choice. What was once seen as civic duty now felt like individual overkill. When mandates ended, masks became mirrors. The moment masks became optional, they turned into mirrors, reflecting personal beliefs more than public rules. Some wore them to protect vulnerable relatives. Others stopped to reclaim normality. It wasn't just about health, it was identity, values, fatigue. In Auckland cafes, you'd see a mix, masked baristas, unmasked customers. No one said anything, but the silence spoke volumes. The social contract had dissolved. Everyone was negotiating their own level of comfort, alone. Global echoes. This wasn't unique to New Zealand. From Tokyo to Toronto, masking faded at roughly the same pace once mandates lifted. Even in countries where masks had deep cultural roots, usage declined sharply. Humans, it turns out, crave visible normalcy. Bare faces signal safety, trust, and connection, things we'd been deprived of for years. The pandemic reshaped behavior, but it couldn't rewrite our psychology. We wanted to see smiles again, even if the risk hadn't vanished completely. Did we move on too soon? Here's the uncomfortable question. Did we drop the masks too early? Hospitals still report waves of respiratory infections. Immunocompromised people feel left behind. Some experts warn that normalizing unmasking during surges could cost lives. But public health isn't just about biology. It's about compliance. If rules no longer resonate with how people feel, they fail. So governments shifted from enforcement to education, letting individuals decide their own thresholds. In other words, responsibility moved from public to personal. The mask's quiet legacy. Even if few wear them now, masks left a deep mark. They changed how we view illness, air, and community. Some people still carry one, just in case. In healthcare, masking remains a quiet constant, not mandated, but wise. And every flu season, when coughs echo through classrooms and buses, some reconsider that little piece of cloth. The era of masking may be over, but the memory of why we did it, that will linger for a generation. A pandemic of memory. COVID didn't just infect lungs, it infected minds. It rewired how we judge safety, how we interpret risk, how we connect. Masking was part of that story, a visible scar of a collective trauma. Maybe that's why we shed them so fast. Not because the virus disappeared, but because the masks reminded us of who we were when we were scared. And sometimes, healing means letting go of symbols, even if the danger isn't entirely gone. The new normal isn't what we expected. So here we are, barefaced, yet not the same. The new normal isn't about fear or freedom. It's about balance. Masks went from mandatory to optional because society reached an equilibrium between risk and reality. We didn't stop masking because COVID ended. We stopped masking because we couldn't live indefinitely in crisis mode. And that's the paradox of survival. To move forward, we sometimes have to forget what saved us. The final breath. When the next pandemic comes, and it will, we'll remember the lessons, not the mandates. We'll weigh the trade-offs faster, communicate better, and maybe mask without hesitation when it truly matters. But for now, the world breathes freely again. The air is the same, but we are not. The masks are gone, yet their story lingers. A quiet reminder of how fragile and how adaptable humanity really is.
That's it for today. I'm Lu Tsen, and this is your Health Decoded NZ. Clarity Unlocked, so you can make sense of the facts and see the differences for yourself. Please remember to subscribe and feel free to leave a comment.